Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Chiropractic Posture and Movement Clinic. This video has to do with pain right in between the shoulder blades and just right in the part of your back, between the upper back and the lower back. And that's because you're doing too much typing. So stay tuned. All right, so one of the most common things I see in my practice with movement dysfunction, which we all have, has to do with our lifestyle of sitting and typing and doing all this fun thing and whatever. So what's happening is the area above the diaphragm and below the diaphragm get disconnected. They become one. So if it was supposed to be one, you would be born with it as one. So in fact, the curvature in your mid-back and the curvature in your lower back are opposite. So in a side view, and I'm gonna over-exaggerate, the curvature in my upper back is that way, and the curvature in my lower back is that way, opposite of each other. But when you're sitting for an extended length of time in a chair like this, and you're collapsing there, it all becomes one. And that's when it speaks up. So how do you practice disconnecting them like they're supposed to? It's very simple. What you do is you sit the way I'm sitting with one leg, the arch of one foot is in the knee of the other foot, like that. That allows, chances are if your hip joint on one side, on the top side, is too restricted, you can bring this back. Play with it, it's okay. What I want you to do is to be able to rotate here, not up here yet. Rotate this way so you're opening that up. Do whatever you need to do to get it that way. And your elbows on the ground are going to be as wide apart as your shoulder joint without them being rolled forward. See, the distance of between my two shoulders, if it's rolled forward, is less than when it's straight. So I'm going to place my hand here and straighten this, not sticking my chest out, and bringing it here. Just like that. So right at this juncture, I'm rotating my upper part of my body without slouching it. So I'm pressing down on my elbows, gliding my neck up, and moving my shoulder blades towards my back pocket to make it flat in this area. As I'm engaging my barrel, we'll make sure we put a video on how to engage your barrel and keeping that in place. So I'm not losing the proper form in the upper part or the lower part, and I'm simply getting that rotation in that junction, just like that. So you don't want to be like this. That's not doing the work. Keep it there for as long as you're able to hold it without compromising the position. Then you come up and you do it on the opposite side. So once again, I start with that, keeping it there, rotating. I'm going to move down here a little bit, rotating it that way, like this. If you're having an issue here, play with it. What you don't want to do is curve it back. If you have this issue here, you definitely have what's called pelvic floor dysfunction. So there are a whole bunch of things you should be doing. What we're doing in our office now to help that out is this machine that helps you with strengthening the inner lining of your pelvis. That's called Amsella, that does 400 kegels a minute. So anyway, we'll make sure we put a link to Amsella right in the description box here too. So check it out. If you have any questions, make sure you send them to me using one of the methods of contact, and don't forget to subscribe. Until next time, take care.